missing from direct pay models? So, for example, now we have UBERDOC, which connects the patients who need an expert with someone qualified that is willing to take money directly from them. Sounds awesome. So you've solved that networking, matching problem. But what else is needed in terms of technology tools, policy, market readiness to really make this take off?
What happens with the next step? You see that orthopedic and they say, okay, we want to do an injection. So now the orthopedic or an x-ray, the orthopedic has to have a price for the x-ray. And if they don't do their own x-ray, they have to work with imaging, and that's where green imaging comes in. These amazing companies that's really breaking the mold to repurpose, to optimize existing equipment and staff and navigate patients into those spots for a transparent price. It's a brilliant model.
Right.
So then, of course, you need to get a prescription, and you want to make sure that prescription is transparent. You may need to go to surgery, but you want to make sure that that price may be transparent. So the moonshot for UBERDOC is we start with the first step in the doctor's office, but then after that, if you want to proceed through a transparent model, there should be transparency. Doesn't mean that you set the price, because the prices are going to vary from like Texas to Oklahoma to Maine to New England, right? I mean, it's always, you can't predict, but you can set the transparency. And so ultimately, you want to make sure that the next steps are always going to be important. UBERDOC is about that first step, because I believe that many things can be solved in that first step. You go to an expert who's seen it a million times, you're going to get the answer. And I think that we have spent way too long assuming, again, that specialists are more expensive. They're not. That they, will order out a lot of tests you don't need. Probably not. I mean, it's like, good behavior comes from good healthcare. Good medicine is good behavior. And like my dad said, just take good care of the patient and you'll be financially successful. So I think that, like you said, those next steps, what comes next, what's the obstacle? In terms of just UBERDOC getting patients to change their behavior, to look for direct pay models. And that's really on us, doctors, to show that you can trust us, that we are going to give you a transparent price. And there's legislation about surprise bills. There's more consumer protections coming down the line. I think 5-6 years ago, it was a lot harder to convince people. Now everybody's deductible is high enough. Everyone's paying, no matter how great your insurance is. So I think now it's an easier sell, and to get that patient behavior to change and to get them rewarded, right? If cash back rewards, if you pay cash for your care, you should pay less of a premium.
Yeah, no, I think it's fascinating and how quickly it seems to be turning, and at least traction in that direction. I know I was listening to an Andreessen Horowitz podcast maybe a year and a half ago, where they were talking about LASIK eye surgery, and in the malls, accessible, direct pay, get the insurance company out, and this is what consumers want, even for that level of specialization. So I think it's awesome that you're supporting that at that next step. And yeah, I know I hear you that accessing the rest of what care could mean, whether that's more tests or procedures, etc., is an important for the completionist aspect of having this alternate system. But I think what you have in terms of, hey, direct primary care plus these specialists are probably 80-90% of what you actually need or want, makes a lot of sense.
Right. I mean, and a lot of times you're going to solve it in an office. You're going to solve it. It's, again, technology's brought us so far where we do outpatient knee replacements, for goodness sakes. I operate in my office this morning. It's like the stuff I used to do in the OR, I can do in the office, and many times I don't operate at all. I just give you a pill and it takes away your arterial disease. So there's so much in technology right now that has changed the delivery of healthcare. The delivery of medicine, I should say, medical care, that the healthcare system has to adopt to medicine.
Right. And the system is never going to adapt as fast as a market, open market.
You are 100% right. And so knowing that it's the patient that is the one in charge, knowing that it's that we don't live in a we know what's best for you world anymore, right? We respect autonomy and choice. And in that environment, then of course, yes, the patient is the consumer, the patient drives it. And the patient should be rewarded for good behavior. The patient should get the bonus. If they don't utilize, why are you giving it to your doctor? Give it to your patient. Give it to the patient.